My name is Deborah Conrad, and I'm a physician assistant at a local community hospital. I've been there about 15 years. I'm a hospitalist PA. I take care of the inpatients. So if you're in the emergency room and you have to be admitted to the hospital, you'll see me, and I'll take care of you throughout your hospital stay and discharge you when you're ready. I love my job. I love my job. Being in the medical field and knowing how important it is to make sure that we keep patients safe is #1 priority. January, February is when we started hearing about the pandemic, and then I remember the day that they closed churches and schools.
The fields are empty, the playground's deserted.
And that's when it really hit home for me, and I realized, okay, it's coming here, we gotta get ready. I was actually sent into a larger hospital to learn and train how to take care of potentially catastrophic situations. Many of us just had severe anxiety during the pandemic, thinking we were bringing this home to our families. There was a bunch of us that went to learn how to do mass casualty training in case we needed it. So that was a little scary, and that's kind of when it really hit home for me. The vaccine rollout went pretty smooth at our hospital. I've never experienced an emergency use vaccine or an emergency use, really, anything in my lifetime. I've been pro-vaccine. I mean, my kids are vaccinated. We rolled them out to pretty much like essential workers and all that first. There were many that were excited about it, and I understand we were all looking for a way out. After rolling them out then to the kind of general public, the elderly and in nursing homes in the area, we would get elderly in with COVID. It was kind of interesting. And it was weird. It was almost like a week after they would get their first dose, they would test positive for COVID. And then we started seeing patients coming in, I got my vaccination, and a week later they're in with pneumonia. I can say for sure in 2021, this is the year of pneumonia. Independent of COVID, I've never seen people with so many pneumonia, sepsis. And even in the middle of summer, all summer, that's what we would get in the hospitals, pneumonia, pneumonia, pneumonia. After the vaccine rollout, I definitely noticed an uptick in heart attacks, strokes, blood clots, gastrointestinal bleeds, gastrointestinal complaints, appendicitis. We even saw pancreatitis, recurrent cancers. It was noticeably increased, where it wasn't just me noticing it, everybody seemed to notice it. It became clear to me that there was something wrong.